Welcome to the Deep Dive. We're here to break down complex ideas into, well, hopefully surprising insights for you. And today we're tackling something that touches so many lives, especially now dealing with emotional distress, with mental health challenges, the stress of modern life, global events. Finding calm can feel like a real struggle, and for many, medication is part of navigating that. But our deep dive today isn't just about mental health meds. It's about a specific, powerful approach called mindful medicating. We're drawing on the fantastic work of Dr. Fong Cheng Kar, who's a mindfulness-based psychiatrist over in Malaysia. He shared these insights at the Asia-Pacific Mindfulness Conference. So our mission here today, it's really about exploring how you can build a more mindful relationship with your medication, making that whole process feel more intentional, more effective, and maybe a bit less daunting for you. Okay, so let's start with mindfulness itself. We hear so much about its benefits for mental well-being, right?
Absolutely. And it's huge. There's good science behind it, too. You mentioned studies like those reviews in 2019 and 2015.
Yeah, Curry's work and others, they consistently show mindfulness helps with stress, anxiety, even mild depression.
Exactly. And for those milder conditions, mindfulness strategies can be incredibly effective. Sometimes medication might not even be needed.
That's the hope for many, I think.
It is. But here's the crucial point Dr. Carr really stresses for more severe conditions. Things like schizophrenia, bipolar disorder, really intense anxiety or depression, or chronic insomnia that just wrecks your life. Well, in those cases, medication often isn't just helpful, it's actually necessary, at least for a period, to get things stable.
Okay, that makes sense.
And, you hear this from patients. People dealing with severe symptoms might try meditation or yoga or even structured programs like MBSR or MBCT.
And feel like it's just not working.
Precisely. They get discouraged. And Dr. Carr explains why. If your basic functions are totally disrupted, you can't sleep, can't eat properly, your mind feels foggy or just overwhelmed, trying to focus and meditate, it's incredibly difficult, almost impossible sometimes.
Or you need some stability first.
Exactly. So medication can provide that vital stability. It helps manage the acute symptoms, gets you to a place where mindfulness can then work effectively. Then mindfulness becomes brilliant for maintenance, for preventing relapse. Dr. Carr has this great analogy. He calls it using both hands.
Both hands.
Yeah. Medication plus mindfulness. Working together. It's not one versus the other. It's mindfulness with medication. A team effort, really. Being pragmatic and kind to yourself.
I really like that both hands idea. Shifts it from a fight to, well, a partnership.
Yeah.
So if we're embracing this partnership, how do we actually bring mindfulness to the act of taking medication, which can be, let's face it, kind of routine or even emotionally charged? Maybe we should start with the basics, like what is mindfulness in this specific context?
Good question. So the classic definition we often hear from John Kabat-Zinn is great. Paying attention in a particular way, on purpose in the present moment, and non-judgmentally.
Right, the standard definition.
Yeah. But Dr. Carr, through his Mindful Gym program, offers a slightly expanded view that's really helpful for mindful medicating. He defines it as remembering to pay attention to the present moment with an attitude of kindness, a beginner's mind, and wisdom.
Okay, so remembering is key there. Plus kindness, beginner's mind, and wisdom. That feels richer.
It is. And those additions, remembering kindness, beginner's mind, wisdom, alongside attention, become the 5 core components, or the 5 R's, as he sometimes calls them. They form the foundation for this practice.
This is where it gets really practical, I think, taking it from theory to something you can actually do. So these 5 components, memory, attention, kindness, beginner's mind, and wisdom, they're the pillars.
Exactly. They turn taking medicine from something automatic, maybe even dreaded, into something intentional, empowering even.
Let's unpack the first one then, memory. That seems straightforward, but how does it fit into mindfulness?
Well, it's interesting. In the original Pali texts, sati, which we translate as mindfulness, often means to remember or to recollect. It's a core aspect, sometimes overlooked in modern takes.
Ah, okay, so not just remembering in the everyday sense.
Well, yes, in the everyday sense, too. Fundamentally, mindful medicating starts with remembering to take your medicine as prescribed. Simple, but crucial for effectiveness.
And easy to forget, especially when you're stressed or juggling things.
Totally. So Dr. Carr has some very down-to-earth tips from his practice, like take notes when you're with your doctor. Anxiety can make details fuzzy.
Good point.
Or bring a trusted friend or family member, not just for support, but as an extra set of ears to help remember instructions.
That's smart.
And never, ever hesitate to call the clinic or pharmacy if you're unsure. It's responsible, not bothersome.
Right.
Then for the day-to-day, simple tools work wonders. A pill box is a great environmental cue, like having a poster that reminds you to breathe mindfully.
Visual reminder.
Yeah. Or set a gentle alarm, a mind bell on your phone, and consciously link that sound to this practice.
Okay, so memory is step one. But you mentioned it's more than just recall. What about attention? How do we pay attention to taking a pill?
Ah, yes. This is about moving beyond just remembering to really being present with the act itself. It's about tackling what Dr. Carr calls mindless medicating.
Mindless medicating.
Yeah.
Like when you take a pill and 5 minutes later you think, wait, did I actually take that?
Exactly. That's it. Your mind was elsewhere. So just like mindful eating, where you focus on the taste and texture, you practice mindful taking.
Oh, what are the steps?
Minimize distractions first. Phone away, TV off, pause the conversation, just for that moment.
Okay, focus.
Then engage your senses. Feel the pill in your hand. Notice its color, its shape. Feel the sensation of swallowing it with the water.
Really tuning in?
Mm-hmm. You can even use a soft mental label, like silently saying, taking med, I know I'm taking med. Just a gentle confirmation.
I like that.
And maybe add a little ritual, a mindful breath before or after. Maybe even a gentle smile. It anchors you, makes it deliberate.
It sounds like your mindset, the way you approach it mentally, is just as important as the physical action.
It's huge, absolutely huge. And this taps into things like the placebo effect. We know belief is powerful in medicine.
Right, the power of positive expectation.
Yeah. If you, your doctor, your family, if everyone involved believes the medication can help, it's genuinely more likely to be effective.
And the opposite is also true.
Unfortunately, yes. That's the nocebo effect. If you strongly believe the medicine is harmful or you're fixated on potential side effects, you're actually more likely to experience negative effects. Perception matters.
Wow. So our beliefs can literally shape the medication's impact.
To a degree, yes. Dr. Carr even shared this neat clinical trick. He gives patients a mindful gym sticker, something friendly and positive to put over the standard pharmacy label on their medication envelope. Because those standard labels can sometimes look stark, clinical, almost like a warning. Putting a positive sticker over it subtly shifts the perception. It reframes the medicine from something potentially poisonous or scary to something helpful or therapeutic.
That's brilliant. Such a simple, non-drug way to nudge the mindset.
Isn't it? It's all about cultivating a positive relationship.
Okay, that makes perfect sense. So next component, kindness. Bringing compassion into taking medicine. That might feel a bit unusual for some. How does that work?
It really transforms the feeling around it. Dr. Carr suggests starting with gratitude. Just take a moment. Think about everyone involved in getting that medicine to you.
Like who?
The scientists who researched it, the company that made it, the doctor who chose it for you, the pharmacist who dispensed it carefully. Acknowledging that whole chain of human effort and care.
That does shift the perspective. It's not just a pill. It's the result of a lot of work.
Exactly. And then bring that kindness inward. Be gentle with yourself, with your mind and body as you take it. Set a kind intention. Dr. Carr shares this lovely personal practice. He sometimes hums a Malay folk song called Rasa Sagang, which means feeling loved, while taking his own medication, maybe gently stroking his tummy or heart area.
Oh, that's beautiful. Like a little ritual of self-compassion.
It really is. He even offers a positive self-talk phrase you could use, something like, "Dear brain, body, and medicine, please meet one another. I hope you can be friends for mutual benefit. May you be safe, healthy, and happy."
Friends for mutual benefit. I like that framing.
And you can even extend that kindness outward wish well for others around the world who might be taking similar medication for similar struggles. Connects you to a larger sense of shared experience.
That's incredibly touching. It changes it from a clinical act to, well, an act of care. Okay, next, beginner's mind. This is a core mindfulness concept, seeing things fresh, without judgment. How do we apply that to medication? Especially if we're worried about side effects.
This is all about approaching the experience with curiosity instead of prejudgment or fear. Dr. Carr suggests using a simple medication tracker.
Like a journal.
Yeah, or an app. Just a place to jot down your thoughts, feelings, body sensations, maybe any changes in behavior you notice after taking the medication.
Okay.
But the key, and this is crucial, is to do it non-judgmentally. Just observe and note. Like a scientist collecting data without immediately jumping to conclusions about what caused what.
And to discuss that data with your doctor.
Exactly. It makes those conversations much more specific and helpful. And this beginner's mind is especially vital when dealing with worries about side effects.
How so?
Because our minds tend to jump to conclusions, right? Dr. Carr teaches his patients to pause and consider 3 possibilities whenever they notice an effect. 1. Could it actually be a side effect of the medicine? 2. Could it be a symptom of the illness itself? Like, heart palpitations during a panic attack aren't usually caused by the anti-anxiety med, they're part of the panic.
Right, distinguishing symptom from side effect.
Yes. And 3, could it be something else entirely? Maybe another underlying medical issue, like a thyroid problem causing similar symptoms.
So, keeping an open mind.
Precisely. Remember that Frank Zappa quote? A mind is like a parachute. It doesn't work if it's not open. Having that open, beginner's mind reduces anxiety and helps you make genuinely wise decisions about your treatment, together with your doctor.
That's such a helpful framework, considering those 3 possibilities. It stops that immediate jump to blaming the medication for everything.
Yeah, it counters that tendency. Because it is really hard, especially when you're feeling unwell or anxious, not to immediately assume the worst about a new sensation.
Absolutely. Fear can take over.
It can. So the tracker helps ground you in observation, not just fear. And consistently noting everything good, bad, neutral gives a much more balanced picture over time. It's about training that pause, that mindful gap between stimulus and reaction.
Which brings us nicely to the last component, doesn't it?
Yeah.
Wisdom. This feels like it ties everything together.
It really does. Dr. Carr explains that mindful medicating is ultimately guided by practical, down-to-earth wisdom, and specifically the wisdom of acceptance.
Acceptance, that can be a big one. Acceptance of what, exactly?
Several things. Acceptance of the illness itself, first of all. Acceptance of the need for medication, even if you wish you didn't need it. Acceptance that there might be side effects to manage. And also, crucially, acceptance that effective treatment is usually holistic. It's not just the pills. It involves family support, lifestyle changes, therapy or counseling, and ongoing mindfulness practice, all working together.
A whole picture.
Yes. He told this really inspiring story about a psychology professor who lives with bipolar depression. This professor fully accepted his condition and his need for daily medication. He didn't fight it, he integrated it with his mindfulness practice.
And the outcome.
He leads a completely functional, rich life. He understands that medication is part of his toolkit for well-being right now, and there's absolutely no shame in that. It's wise self-care.
That's a powerful example of acceptance in action. But, accepting a mental health diagnosis and needing ongoing medication, that can be incredibly tough. There's still stigma, internal resistance. How does Dr. Carr suggest people cultivate that acceptance?
That's a very real challenge. He offers something really practical and compassionate here, his 5 mindful vitamins. Think of them as positive coping statements you can practice regularly.
Okay, mindful vitamins. What are they?
The first is, I'm not alone. Just reminding yourself that countless others share similar experiences, take similar medications. Connecting with support groups, or even just knowing you're part of this larger community reduces that isolating feeling.
That makes sense. Reduces the stigma too, maybe.
Hopefully, yes.
Yeah.
The second vitamin, what can I do now? This is about focusing your energy on what's actually within your control regarding your recovery. Let go of battling things you can't change right now. It shifts you from feeling helpless to feeling empowered.
Focus on the actionable steps.
Exactly. Third, what have I learned? This encourages finding meaning. Can you see the illness, challenging as it is as a kind of teacher? Dr. Carr shared personally how his own experience with panic attacks ultimately made him a more empathetic psychiatrist. Finding that meaning can be transformative.
Turning adversity into growth.
Fourth vitamin, it could have been worse. This sounds a bit like comparing, but it's really about cultivating gratitude. Being thankful for access to treatment, to medication, which sadly isn't a given for everyone globally. It fosters appreciation for what you do have.
Perspective.
Yes, and the 5th and final vitamin, this will also pass. A classic reminder of impermanence. Things change, conditions change. Even if a condition doesn't fully disappear, your ability to cope can improve, especially with mindfulness skills. It instills hope and reinforces resilience.
Wow, those 5 vitamins, I'm not alone. What can I do now? What have I learned? It could have been worse, and this will also pass. Feel like really concrete tools for building that acceptance.
They really are.
Yeah.
Very practical, very kind.
What an incredibly insightful deep dive this has been. We've walked through Dr. Carr's whole framework, the 5 pillars of mindful medicating: memory, attention, kindness, beginner's mind, and wisdom. These aren't just ideas. They're practical steps, things you can actually start doing to change your relationship with medication, making it feel less like a burden and more like an act of genuine self-care. So as we wrap up, here's something to think about. Dr. Carr talks about that 2 hands approach, integrating things that might seem opposite, like medication and mindfulness. Where else in your life might this both-hand thinking be helpful? Where else do you feel stuck between opposing forces, maybe work and life, ambition and well-being, independence and connection? Could bringing acceptance and mindful engagement to those areas unlock new possibilities, maybe turn a struggle into a path for growth? Definitely something to consider. And if you want to read more from Dr. Carr, check out his articles on the Mindful Gym blog.
Yeah, and just thinking about the bigger picture, it really comes down to finding that sense of agency, finding peace within your own health journey, whatever that looks like for you. This knowledge, these practices, when you apply them mindfully, they become really powerful tools, not just for managing medication, but for living more fully, more presently, and with more kindness towards yourself.